Good morning. In this video, I'm going to talk about pain medications. Pain is one of the most common reasons people visit doctors or take medications, but not on all painkillers are the same. While they bring pain relief, they can also bring risks. Today, we'll break down the types of painkillers, how they work, their pros and cons, and the real risks of addiction. And finally, safer and natural alternatives you can consider. Types of painkillers. Non-opioid analgesics like NSAIDs or acetaminophen. For example, ibuprofen, naproxen, diclofenac, aspirin, and acetaminophen. How they work? They block enzyme called COX that produce prostaglandins, chemicals that cause pain, inflammation, and fever. It's best for headache, muscle ache, joint pain, fever, mild arthritis. Long-term use can harm stomach, kidney, and heart. Even Tylenol, acetaminophen in high doses can damage liver. Opioid analgesics, for example, morphine, oxycodone, hydrocodone, codeine, fentanyl, and tramadol. How they work? They bind to opioid receptors in brain and spinal cord, blocking pain signals. Best for moderate to severe pain after surgery, cancer, or trauma. It should not be used on long-term basis. Caution: risk for tolerance, dependence, addiction, and prolonged use. Adjuvant analgesics, usually we use it for nerve pain. Example, antidepressants, amitriptyline, duloxetine, or anticonvulsants like gabapentin and pregabalin. How they work? They stabilize nerve activity, reduce neuropathic pain. Best for diabetic neuropathy, shingles pain, fibromyalgia. They can cause dizziness, drowsiness, and weight gain. Topical and local treatment: lidocaine patches, diclofenac gel, capsaicin cream. They act locally on nerve and tissue to block pain signals. Best for localized muscle or joint pain, arthritis, or post-injury pain. Pros and cons. Pros: quick pain relief, improved function, allow healthy healing by reducing inflammation, enable rehabilitation or physical therapy in severe cases, help maintain dignity and quality of life, like cancer pain. Cons: stomach ulcer, bleeding because of ibuprofen-like medication, liver toxicity from high dose of acetaminophen, constipation, nausea, and sedation because of opioids, tolerance, need higher dose over time, dependence and withdrawal symptoms, and masking underlying disease instead of treating it. Risk of addiction is really high with certain medication. Opioid addiction happens all the time. We see it every day because the drugs stimulate brain reward system, releasing dopamine, the pleasure neurotransmitter. Over time, the brain adapts, requiring higher doses of the same medication because of tolerance. Stopping suddenly leads to withdrawal, cramps, stomach cramps, anxiety, insomnia, psychological craving develops even without physical pain. In US, about 2 million people struggle with opioid addiction, often starting from legitimate prescription. That's why medical professionals use the term opioid stewardship, only short-term use under supervision. I usually do not prescribe long-term and usually send those patients for pain management specialist referral. Safer and natural alternatives: herbs, exercise, meditation, scenes. Those are very helpful. Physical and behavioral therapy, posture correction, stretching exercises, heat, ice, yoga, mindfulness-based stress reduction helps quite a bit. Anti-inflammatory diet, rich in omega-3, turmeric, ginger, and antioxidant-rich food, they all help, and you have to use them on regular basis. Herbal and nutraceutical support: turmeric, curcumin, they reduce inflammation naturally. Boswellia serrata, they are proven for joint pain relief. Ashwagandha reduces chronic stress and inflammation. Magnesium and omega-3 support nerve and muscle relaxation. And then you have a pain-specific supplements like glucosamine, chondroitin sulfate for arthritis, or milk thistle for liver protection. Gradual tapering plans if someone is on opioids, It's really helped to patient get up those medication. Painkillers can be life-changing when used correctly, but life-threatening when misused. Always treat the cause, not just the symptoms. Combining medication with the movement, right attitude, nutrition, stress control leads to true healing. So pain relief is possible safely. So thank you for watching and thank you for sharing my video.